We were the first to pilot it a couple of years ago, and it basically allows us to be more responsive to the client's needs by being able to take their observations and uploading them to the GP. It looks very similar to an iPad, so we can take people's blood pressure, oxygen, temperature and various other observations that we need.
The idea of the technology is that we remotely monitor all the patients in the nursing and residential homes, so I can pick up trends. I can also look at urinary tract infections, so the homes have the ability to monitor the colour strips that we use and then press the iPad to tell me what the reading is, and then that gets transferred into the telehealth program, which then allows me to see what infection they've got and then treat accordingly with the antibiotics sooner rather than later.
We have 19 residents here, and we also have daycare clients come in. What happens is every individual client is uploaded onto the system. The GP sets the parameters for that individual client. We take monthly readings, but we also use it on a responsive level, so if somebody has a fall or someone seems to be unwell, we're able to do those observations and then speak to either 111, 999 or the GP that has direct access to it.
Telehealth for me is a real benefit because it allows me to look at patients without being invasive, but it also gives me a picture of how and peaks and trends so that I can then act on that accordingly. For the patient, they're getting something quite timely, but actually they also enjoy it. They want to know what their readings are, and they've taken a bit more control of actually perhaps their conditions.
It does empower our staff. We know that client obviously much better than somebody outside of our home, so whereas before we'd make that decision but not actually have the evidence perhaps to hand that over, now when we ring up 111 we say these are the observations we've taken. They're really pleased that we've actually have that information to hand, and whereas before I say they would send somebody out generally, now they will just say, perhaps if you're happy, can you continue with the observations? They'll give us the guidance that we need, and again we can work on that.
Telehealth has made a reduction into ambulances being dispatched into the community. Before telehealth was introduced, every call that would come in to the control room would have to go through pathways, but it would result in an ambulance being sent to all the calls that come in.
Before the technology came along, what we would have done was go out and do individual visits, and that may be myself or a practice nurse, which has taken away time from their clinics that they run here at the practice. And then if we wanted it over a few days or a few visits, then it's, taking time away from other patients. Whereas now the homes are trained to be able to take that reading and it comes straight through the system so that then we can monitor that trend.
Being able to actually support the clients in their own environment has not only kept them safe, but actually being in hospital can cause a lot more stress to the individual and actually cause them more harm emotionally. 90% of our clients have a form of dementia, and the environment is very important to them. They can become very unsettled in a new environment, new surrounding. Often the client would go to A&E, which is a very busy place and not necessarily the right place for somebody with dementia.
Telehealth is great because it's about recognising the condition earlier. The patient experience, their recovery rate is a lot quicker to get back to their normal lifestyle because the condition is actually been picked up so much further down the line than what it would have been had it resulted to an ambulance attendance.
What it's done is bring together not just myself but our nursing and residential home colleagues, and also join in our GP partners, because we're able to talk about patients.
After we've had telehealth for a couple of years now, we wouldn't be able to provide the best and responsive service to our clients without it.